virus outbreak outside of China. More than $28 billion has been set aside to bolster the economy, 3 times more than the amount initially allocated. It's day 2 of a nationwide lockdown across Italy, where more than 10,000 cases have been confirmed.
In the financial hub Milan, streets are largely empty. Famous boutiques and restaurants have closed their doors. 60 million Italians have been told to stay home and to avoid all non-essential travel for about a month. The government has warned that it hasn't ruled out even more restrictive measures.
Several European nations have banned Italians from crossing their borders. Spain and Portugal have suspended air traffic for 2 weeks.
And Slovenia says that it will close its border with Italy, while Austria has ordered a halt to air and rail services. But Germany has condemned such restrictions. Chancellor Angela Merkel says European countries should not isolate each other.
She's called for all EU countries to work together, saying experts have told her up to 70% of the population might become infected.
Meantime, in the United Kingdom, the junior health minister has tested positive for the virus. Nadine Dorries is self-isolating at home. Mrs. Dorries was at a reception last week with hundreds of parliamentarians, including Prime Minister Boris Johnson.
More on this now with Dr. Leong Ho Nam from Mount Elizabeth Novena Specialist Centre in Singapore. Dr. Leong, experts have warned that there could be a second wave of COVID-19 infections. What's your take?
Absolutely. If you look at China, the first country that's coming out of COVID-19, they're experiencing many new cases, not from their own cities, but coming out from overseas. People who are returning to China or people are coming in to do business. So as you clear your own cases, you get your second wave of people returning. So we see that in Singapore, we see foreigners are coming in, and certainly we'll see that in Korea, Japan, or any other countries. The foreigners will be driving the second wave.
Mm-hmm. And as part of that, Dr. Leong, explain to us why we're seeing such a dramatic rise in the number of cases in places like Italy and now in the United States.
Now, we have to understand a few things. In order for the virus to be effectively controlled, you need to have a determined government with good political will. You need to have a good, ready testing facility, which means the number of tests must be done and ready and quickly control them. And we saw that in China, when the test became available and we saw numbers coming down very quickly. And we saw that in Korea as well. They are doing 10,000 tests a day. They even have a drive-through test for PCR. So when there are more tests that are done, it allows the third layer, which is searching and quarantining. When you search and quarantine, you prevent spread of new cases, and this in turn will control the epidemic curve. And the last and most important factor would actually be people. The people have to be cooperative and listen to the authorities, listen to the doctors, the advisors, to actually stay in the house and not go out. This would mean cutting down the social interactions and the social distancing which we are talking about. So from government, testing, search and quarantine, and lastly, that of a cooperative citizens. With all these 4, we will have a control of the situation. In the case of Italy, they were prepared, but they were not ready, which means that they were prepared as in they knew what to do, but they didn't have the test kits that could run into thousands at a day. Number 2, in the case of USA, we're seeing numbers rise. Again, the same problem. We have them prepared but not ready. The test kits were controlled within the federal states, but they were not released to the individual state laboratories. When the control was loosened to the state laboratories, we saw the numbers rising up because they are finally detecting the cases with COVID-19. So mark my words, the number of tests which you do, the efforts which you quarantine the patients, these 2 factors will determine how soon you can control COVID-19.
Speaking of controlling the outbreak, is a vaccine the only solution to that, or just by the measures that have been taken in place, will we sort of see it sort of fade away or die out?
I think vaccine is great. Vaccine can solve many problems, including the issues of lack of testing as well as compliance on the part of citizens. But let's be realistic. A vaccine will not come for the next 12 months. And this comes from Professor Fauci, who heads the NIH in USA. I know many steps are being taken to try to cut short the time taken, but we're still looking at 12 months if we want to do proper trials in testing. But we have something else ahead of us that's readily available, and that means better testing. Again, the more tests the country do, it seems to be more predictive of a control of the virus. Second, social distancing. We can actually take on individual responsibilities and not meet other people. Remember, the virus has to infect a new person in order to transmit. If I have the infection, I don't meet anyone, the virus will stay with me and die within me, and I can't infect other people. That is rather the better panacea. That is actually the thing we should teach all our citizens and everyone in the world. Prevent your infection to other people, and we can control the virus until the vaccine comes 1 year later.
All right, many thanks, Dr. Leong, for sharing your expertise with us. Dr. Leong Ho Nam from the Mount Elizabeth Novena Specialist Centre.